Did you know that 240,000 people in the United States experience mini-stroke, also known as Transient Ischemic Attack (TIA), every year? Mini-strokes, or transient ischemic attacks, can be a serious warning sign of a major stroke. While not everyone who experiences a mini-stroke will go on to have a full-blown stroke, the risk is significantly increased. As we age, the risk of mini-stroke, including stroke, does increase. While it's true that people over 55 are at higher risk, it's essential to understand that mini-strokes and strokes can occur at any age. The risk goes up as we get older. That's why it's crucial for everyone, especially older people, to be aware of the signs of a mini-stroke. A mini-stroke happens when the blood flow to the brain is temporarily blocked. This is most often caused by a blood clot or plaque buildup in the arteries, though sometimes it can be due to a temporary blood vessel spasm. This interruption in blood flow causes symptoms similar to a full-blown stroke, but they're usually milder and may only last a few minutes or hours. Recognizing the signs of a mini-stroke is vital because it can be a critical warning sign of a more severe stroke in the future. Unfortunately, many elderly individuals face unique challenges when identifying mini-stroke. They may be more likely to dismiss their symptoms, attributing them to other age-related conditions like arthritis, memory issues, or simply getting old. Additionally, mini-strokes often present with subtle symptoms that can be easily overlooked or misinterpreted. By the time a family member notices or the individual decides to mention it, the symptom might have vanished entirely, making it easy to forget or downplay. This overlap makes distinguishing between age-related changes and potential warning signs of a mini-stroke difficult. Some elderly individuals may have pre-existing cognitive impairments, such as dementia or Alzheimer's disease, which can further complicate the identification of mini-stroke symptoms. Caregivers might also misinterpret new symptoms as a progression of the existing cognitive impairment, rather than recognizing them as a potential sign of a mini-stroke. Sometimes, seniors may not even realize they're having a mini-stroke, especially if the symptoms are mild or fleeting. That's why it's so important for caregivers, family members, and healthcare providers to be proactive in monitoring their loved ones for any signs of a mini-stroke. Delayed treatment for a mini-stroke can have devastating consequences. It significantly increases the risk of another stroke, which can lead to permanent brain damage, disability, and even death. The risk of a full-blown stroke is highest in the days and weeks immediately following a mini-stroke, making prompt action essential. The good news is that prompt medical evaluation and treatment after a mini-stroke can substantially reduce the risk of a future stroke. But to get this crucial treatment, it's essential to recognize the signs of a mini-stroke and seek medical attention immediately. We would love to know where you are watching from. Tell us in the comment. You need to watch this video because we will also discuss preventive measures. As previously stated in this video, a mini-stroke is also known as a transient ischemic attack, TIA. Therefore, we shall use both terms interchangeably. Here are 10 critical signs of a mini-stroke that everyone, especially the elderly and their families, should be aware of. Number 1. Sudden weakness or numbness in the face, arm, or leg. Sudden weakness or numbness is a critical sign to watch for. It's not just feeling tired or having a numb spot. We're talking about a significant change in your ability to move or feel. Think of it like a switch being flipped. One moment you're okay. The next you're experiencing a dramatic shift. This isn't gradual. It happens abruptly, often within seconds or minutes. This weakness can manifest as a sudden inability to lift your arm, grip something, or even move your leg. Imagine trying to raise your arm and finding you simply can't, or that your leg suddenly gives way beneath you. Numbness, on the other hand, is a loss of sensation. You might not be able to feel touch, temperature, or pain in the affected area. It can feel like pins and needles, a strange tingling, or a complete loss of feeling, almost as if the limb has gone to sleep without the usual cause, like prolonged pressure. Imagine touching your leg and feeling nothing, or experiencing an unusual tingling sensation that wasn't there before. While it's not always the case, this weakness or numbness often affects one side of the body more than the other. This is because strokes often affect one side of the brain, which controls the opposite side of the body. So, a stroke on the left side of the brain might cause weakness or numbness on the right side of the body. The key takeaway here is this change is suddenness and severity. If you suddenly can't lift your arm, grip something, or feel your leg when you touch it, that's a major red flag. If this happens, even if it seems to go away quickly, don't delay. Call emergency services immediately. Time is critical when it comes to stroke treatment. Number 2. Difficulty speaking or understanding. Difficulty speaking or understanding during a TIA can manifest in several ways, all stemming from a temporary disruption of blood flow to the areas of the brain responsible for language and communication. One common sign is slurred speech, which isn't just a slight slur. It's a noticeable change in how the person articulates words. Their speech might sound mumbled, garbled, or as if they're talking with a mouthful of marbles. They might have difficulty forming words correctly, even with familiar phrases. It's important to distinguish this from simply being tired or having had too much to drink. Slurred speech during a TIA comes on suddenly. Another manifestation is difficulty understanding speech. The person might hear the words, but they can't process their meaning. They might ask repetitive questions, misunderstand simple instructions, or be unable to follow a conversation. It can be as if they're suddenly listening to a foreign language they don't understand. Sometimes individuals experience difficulty finding words. They know what they want to say but struggle to find the right words to express themselves. They might pause frequently, searching for words, use incorrect words, or speak in short, fragmented sentences. This can be incredibly frustrating as they know what they want to communicate but cannot do so. Often, these speech and comprehension problems occur together. Someone experiencing a TIA might have slurred speech and difficulty understanding what others are saying and struggle to find their own words. This combination of symptoms makes communication extremely challenging and can significantly indicate a neurological event. Like other TIA symptoms, the key here is the sudden onset of these speech difficulties. It's not a gradual change. It's a noticeable and abrupt shift in the person's communication ability. This suddenness is what distinguishes it from other potential causes of speech problems. It's important to remember that these difficulties can be subtle and transient. They might last only a few moments, making them easy to dismiss. However, even brief episodes of slurred speech, difficulty understanding, or trouble finding words should be taken seriously, mainly if they occur suddenly. These can be crucial warning signs of a mini-stroke and prompt immediate medical attention. Number 3. Sudden trouble seeing in one or both eyes is also a critical sign of a mini-stroke. Sudden vision problems during a TIA are more than just the blurry vision you might experience from tiredness. These are abrupt and often dramatic changes in eyesight that signal a potential disruption of blood flow to the brain's visual centers. It's not a gradual blurring, it's a sudden shift. One possibility is blurred vision, but not just a little fuzziness. This is a significant decrease in visual clarity, making it difficult to see clearly. Imagine your vision suddenly going out of focus, like a camera lens malfunctioning. Everything might appear hazy or distorted. Another potential issue is double vision, where you see two images of a single object. This can make it difficult to judge distances and can be very disorienting. Imagine looking at a person and suddenly seeing two of them, side by side or overlapping. Perhaps the most alarming of the vision problems is complete loss of vision. This is a sudden and temporary vision loss, either in one eye or both eyes. It can feel like a curtain suddenly closing over your field of vision. This loss of vision can be partial or complete, lasting for a few seconds or a few minutes. Their sudden onset is the key to recognizing these vision problems as potential signs of a TIA. It's a dramatic vision change that occurs quickly, not something that develops gradually. It's also important to note that these vision problems can affect one or both eyes. While blurred vision from tiredness might affect both eyes equally, vision problems from a TIA might affect one eye more than the other, or even affect one eye exclusively. Any sudden change in vision, whether blurring, double vision, or complete loss of vision, should be taken seriously and prompt immediate medical attention. Don't dismiss it as just being tired or needing new glasses. It could be a sign of a mini-stroke and requires urgent evaluation. Number 4. Sudden, severe headache. A headache associated with a mini-stroke is not your run-of-the-mill headache. It's a sudden, intense, and often unusual headache. It's frequently described as the worst headache of my life, unlike anything the person has experienced before. Think of it as a thunderclap in your head. It comes on quickly and reaches peak intensity rapidly. It's not the kind of headache that gradually builds. It's a sudden, sharp, and often debilitating pain. It might be localized to one area of the head or feel like it encompasses the entire head. Because it's so severe and sudden, it's a significant red flag and should never be ignored. It's crucial to distinguish this type of headache from a typical tension headache or migraine. Those headaches usually have a slower onset and might be accompanied by other symptoms like sensitivity to light or sound. Other neurological symptoms such as weakness, numbness, or speech difficulties often accompany the headache associated with a mini-stroke. If you or someone you know experiences a sudden, severe headache like this, especially if other symptoms accompany it, it's vital to seek immediate medical attention. Number 5. Dizziness or loss of balance. Dizziness and balance problems related to a TIA or stroke are not just feeling a little unsteady or lightheaded. They represent a sudden disruption of the brain's balance and coordination centers. This can manifest as a sudden inability to maintain your balance. You might feel like you're going to fall or actually fall. It's not just a momentary wobble. It's a significant loss of equilibrium. Another possibility is vertigo, the sensation that you or the room around you is spinning or moving, even when you're still. It can be very disorienting and make standing or walking difficult. Sometimes individuals experience difficulty coordinating movements. This involves a sudden loss of coordination. You might have trouble with tasks that require fine motor skills, such as picking up small objects, buttoning your shirt, or writing. You might also experience difficulty walking with an unsteady or staggering gait. The key here, again, is the suddenness of these symptoms. It's a dramatic change in your balance and coordination that occurs quickly. It's not just feeling a little clumsy or off balance. It's a significant impairment in your ability to move and maintain your balance. If you or someone you know experiences sudden dizziness, loss of balance, or difficulty coordinating movements, especially if other neurological symptoms accompany it, it's crucial to seek immediate medical attention. These could be signs of a mini-stroke or stroke and require urgent evaluation. Number 6. Sudden confusion or trouble understanding. This isn't just the occasional senior moment or forgetting where you put your keys. We're talking about a sudden and noticeable change in mental clarity. Imagine someone suddenly becoming disoriented in familiar surroundings, not recognizing their own home or family members. It's a significant shift in their ability to think coherently, process information, and understand what's happening around them. They might struggle to follow simple conversations, ask repetitive questions, or be unable to perform basic tasks that they usually could. It's a clear departure from their usual mental state. This confusion can also manifest as difficulty understanding speech. They might hear the words, but the meaning doesn't register. It's like they're suddenly listening to a language they don't understand. This isn't just a little forgetfulness. It's a sudden and significant impairment in cognitive function. Number 7. Sudden nausea or vomiting. While a variety of things can cause nausea and vomiting, their sudden onset, especially when coupled with other potential stroke symptoms, becomes a red flag. It's not just feeling a little queasy. It's a sudden onset of nausea, possibly accompanied by vomiting. Think of it as a sudden wave of sickness. While nausea and vomiting alone might not be cause for alarm, their sudden appearance, especially if the person is also experiencing other symptoms like weakness, speech difficulties, or vision problems, raises the suspicion of a neurological event. The concern is heightened when other signs of a potential stroke accompany these gastrointestinal symptoms. The combination of symptoms makes nausea and vomiting more worrisome in this context. Therefore, while nausea and vomiting can have many benign causes, their sudden onset, especially in conjunction with other stroke-like symptoms, warrants immediate medical attention. Number 8. Sudden difficulty with fine motor skills. This isn't just a little clumsiness, it's a sudden and noticeable difficulty performing tasks that require precise movements. Think about actions like buttoning a shirt, writing, picking up small objects, or using utensils. Someone experiencing this might suddenly struggle to grasp a pen, fumble with buttons, or drop things they're trying to hold. It's a distinct change in their usual dexterity. It's not just a momentary lapse. It's a sudden impairment in their ability to control fine movements. Imagine trying to write your name and suddenly finding you can't form the letters correctly, or attempting to pick up a coin and dropping it repeatedly. Number 9. Sudden facial drooping. This is an evident and concerning sign. It's a drooping or sagging of one side of the face. The person might have difficulty smiling evenly, or one side of their mouth might droop. They might also be unable to raise their eyebrows equally. One eyebrow might remain lowered. It's a noticeable asymmetry in the face that appears abruptly. Imagine someone trying to smile, and only one side of their mouth turns upwards while the other side remains still. This facial drooping is a classic sign of a potential stroke or mini-stroke and requires immediate medical attention. Number 10. Difficulty swallowing. This is also known as dysphagia. During a TIA can arise from several factors related to disrupted brain function. It's not just a minor throat irritation. It's a noticeable change in the ability to swallow effectively and safely. The act of swallowing involves a complex coordination of muscles in the mouth, throat, and esophagus. A TIA or mini-stroke can disrupt the nerve signals to these muscles, making it difficult to control them properly. This can lead to difficulty moving food from the mouth to the back of the throat or propelling food down the esophagus. Weakness or numbness in the muscles involved in swallowing can also contribute to dysphagia. If the muscles in the mouth or throat are weak, it can be difficult to chew food properly or to initiate the swallowing reflex. Numbness can also make it difficult to sense the presence of food in the mouth, increasing the risk of choking. Swallowing is partly a reflexive action, and a TIA can impair these reflexes, making it difficult to trigger the swallowing process. This can lead to food or liquids going down the wrong way, into the trachea, windpipe, rather than the esophagus, which can cause choking or aspiration. Dysphagia can manifest in various ways. Some people might have difficulty swallowing solids, while others struggle more with liquids. Some might experience pain when swallowing, while others might have no pain but still have difficulty moving food down. Common signs of dysphagia include coughing or choking when swallowing, a sensation of food getting stuck in the throat, drooling, and difficulty controlling food or liquids in the mouth. Like other TIA or mini-stroke symptoms, the key to dysphagia is the sudden onset. It's not a gradual worsening of swallowing difficulties. It's a noticeable and abrupt change in the ability to swallow. This suddenness makes it a potential warning sign of a neurological event. It's crucial to recognize that difficulty swallowing can be a serious problem, as it increases the risk of choking, aspiration pneumonia, lung infection caused by food or liquid entering the lungs, and malnutrition. If someone experiences sudden difficulty swallowing, especially if accompanied by other potential stroke symptoms, it's essential to seek immediate medical attention. This symptom should never be dismissed or ignored. Now that we have discussed the signs of mini-stroke, below are preventive measures against mini-strokes. 1. Balanced diet. A diet rich in fruits, vegetables, whole grains, and lean protein is crucial. These foods provide essential nutrients and are generally lower in saturated and trans fats, cholesterol, and sodium, all of which can contribute to plaque buildup in arteries and increase stroke risk. Limiting processed foods, sugary drinks, and excessive alcohol intake is also essential. A healthy diet helps maintain a healthy weight, blood pressure, and cholesterol levels, all of which play a significant role in stroke prevention. 2. Regular exercise. Regular physical activity, even moderate exercise like brisk walking for at least 30 minutes most days a week, has numerous benefits. It helps maintain a healthy weight, lowers blood pressure, improves cholesterol levels, and reduces the risk of diabetes, all key factors in stroke prevention. Exercise also improves circulation and can contribute to overall cardiovascular health. 3. Managing high blood pressure, hypertension. High blood pressure is a significant risk factor for TIA. Often there are no noticeable symptoms, so regular blood pressure checks are essential. Managing hypertension through lifestyle changes, diet, exercise, stress management, and, if necessary, medication is crucial for stroke prevention. Even slightly elevated blood pressure can increase risk, so working with a healthcare provider to maintain healthy levels is vital. 4. Managing diabetes. Diabetes significantly increases the risk of TIA. High blood sugar levels can damage blood vessels, making them more prone to blockages. Effective management of diabetes through diet, exercise, weight control, and medication is crucial for reducing mini-stroke risk. Regular monitoring of blood sugar levels and working closely with a healthcare provider are essential for people with diabetes. 5. Managing cholesterol levels. High cholesterol levels can contribute to plaque buildup in arteries, increasing the risk of mini-stroke. A healthy diet, regular exercise, and in some cases medication can help lower cholesterol levels and reduce this risk. Knowing your cholesterol numbers and working with your doctor to maintain healthy levels is important in mini-stroke prevention. 6. Quit smoking. Smoking significantly increases the risk of mini-stroke. Nicotine damages blood vessels, and smoking increases blood pressure and reduces the oxygen-carrying capacity of the blood. Quitting smoking is one of the most important steps you can take to reduce your risk of mini-stroke. 7. Maintaining a healthy weight. Being overweight or obese increases the risk of mini-stroke. Losing even a small amount of weight can have significant health benefits. including reducing blood pressure, improving cholesterol levels, and lowering the risk of diabetes. A balanced diet and regular exercise are key to achieving and maintaining a healthy weight. 8. Moderate alcohol consumption. Excessive alcohol consumption can increase blood pressure and contribute to other health problems that increase TIA risk. Moderation is key. For most adults, this means no more than 1 drink per day for women and no more than 2 drinks per day for men. 9. Regular checkups. Regular medical checkups are essential for monitoring blood pressure, cholesterol, blood sugar, and other risk factors for mini-stroke. These checkups also allow you to discuss stroke prevention strategies with your doctor and address any underlying health concerns. The most important thing to remember about mini-strokes is the suddenness of these symptoms. If you or someone you know experiences any of these suddenly, do not wait. Call emergency services immediately. Time is critical when it comes to mini-stroke treatment. Have you or a loved one experienced any of these signs? Share your stories in the comments below. Sharing this information could save a life. Don't forget to subscribe to our channel for more health-related videos. Please share this video with your family and friends. It could make all the difference. Thank you for watching, and we'll see you in our next video.